This new age group signed up through the state's new hybrid rollout, and that has some who are next in line pretty frustrated right now because they have now been pushed back. Our Brianna Whitney is live right now to explain these changes, what this hybrid rollout means, and more importantly, maybe why. Brianna?
Well, since the beginning of the vaccine rollout, there's been a lot of confusion because the state pods and the county pods have had different qualifications. But at the time, they were both following a similarly phased approach. Well, now the state has changed course, and that's leaving some essential workers waiting even longer.
Those having to interact with people the most.
We have colleagues still getting sick with COVID.
Could now be waiting even longer than expected to get vaccinated. Cindy Vargas is a pharmacy technician at a Fry's grocery store, and while she is vaccinated, most of her essential worker colleagues in the store are not, and we're expecting to be soon.
It's very confusing. We work with the public every day. The grocery store is open 18 hours a day. People are here from the time it opens to the time it closes.
Originally, both the state and Maricopa County were following this phased approach to vaccine distribution. We've been in the 1B priority phase, and next would have been the full 1B group, including essential workers. Now that's changed for the state. Instead, a spokesperson says they're taking a hybrid approach, deciding to vaccinate 55 and older first, given their illness risk.
More than 80% of all of the severe illness, hospitalizations, and deaths from COVID-19 occur in that group.
U of A College of Medicine Dr. Shad Marvasti says while there is a benefit to this, there's also a catch-22 in making essential workers and younger folks wait longer.
But on the other hand, 80% or more of the spread of COVID in terms of where the cases are coming from occur in the 20 to 54 age range.
A Maricopa County spokesperson says they're staying the course in the phased approach and now trying to redetermine the timeline to get essential workers vaccinated faster in the 1B group. The county says its pods don't have as much vaccine as the state pods, and they're also not open 24 hours like the state sites. So for the county, it's going to take a delegated effort.
They're also doing the more local outreach with local pharmacies and in community centers and local clinics.
That Maricopa County spokesperson said really what's hurting them the most right now is just this lack of supply. Now, they are planning to communicate this new plan to vaccinate essential workers sometime next week, but they said realistically, they expect the demand to outweigh the supply for 1 to 2 more months here. Heather?
It is getting a little more confusing, Brianna. Did the state go into any more detail about why they really decided to shift gears right now in the way that shots are prioritized?
Well, the state said what was playing a factor into that is the population 55 and older are a lot of the people that have underlying health conditions. So they're trying to target that group to take care of them first, since those people are more susceptible to getting a severe case of COVID-19. But they also told me Dr. Christ will be taking questions tomorrow at 10 a.m. and they're prepared to talk specifically more about this issue.
I'm sure there will be a lot of questions. Brianna Whitney, thank you so much.